Chatham, Virginia. Dr. O'Bannon with us now. He knows it well. Graduated from Hargrave, one of their many graduates made good. Hey, Doc, great to have you.
Good morning, John. You got the Straight Talk Express rolling this morning on St. Patrick's Day.
We're rolling, I know, and we forgot to wish everybody a happy St. Patrick's Day. Great to everybody out there. I'm going to be in Alexandria tonight, if I can make my way up there for a Newt Gingrich event in Alexandria. I'm also trying to get to the Ted Cruz event. So all kinds of things happening. I'm sure I will partake in a green adult beverage. 741. Dr. O'Bannon with us. Can't comment on that because he's an MD. Now, Doc, you had this great op-ed in the Richmond Times-Dispatch. Can you share with our audience, first of all, what inspired it, and then some of what was in it?
Sure, John. I appreciate you asking. You know, we've been dealing with the issues around Obamacare now for years. And we had a Supreme Court decision a couple of years ago on the Medicaid expansion. This piece is going to be a Supreme Court of the United States decision in June on the other half of Obamacare, which is the subsidies. This is the exchanges. Mm-hmm. And those of us who've been interested in this and following this have watched the painful way this has played out, because it all goes back to when the original bill was passed, the one Ms. Pelosi said they had to pass to see what was in it. And unfortunately, the words in the document, the 1,700-page bill, are clear that for the citizens who get these federal exchange subsidies, tax credits on your federal taxes, those exchanges have to be run by the states. Mm-hmm. And what happened is, and this was years ago when Bob McDonnell was governor and Bill Hazel was health secretary, they did a big assessment of that, and they said these exchanges are expensive and Virginia should let the federal government do it, which was the alternative. And that's exactly what happened. And now, as we've watched this over the last 2 or 3 years, the state-based exchanges have failed spectacularly. You know, Maryland couldn't get theirs to run. Oregon enrolled nobody without using a pencil, and they all had to be bailed out. And so where we are now is that there are about a third of the states that are running their own. And this Supreme Court decision, if it goes with the folks who are opposed to it, will basically invalidate about two-thirds of the states as far as the exchange piece goes. So it's a big deal. The import is that it gives us an opportunity to go back and renegotiate the Obamacare bill, and I think that's why it's really important that we as a state confirm that we don't want to do a state-based exchange, and that if we get the opportunity, we actually have a chance to do some real health care and some real health insurance reform in Virginia.
Let's be real, okay? You guys made the absolute right decision in not going with the state exchange. No question. You look at almost every one of them, they're all full of problems. They're a disaster. They've overrun by 2, 3, 4, 5x what people thought they'd be. But if this decision comes down, Dr. O'Bannon, you know and I know that if the Supreme Court rules and says, oh, sorry, no exchange, can't get the federal subsidies. And there's, I don't know how many people in Virginia, I've heard, 900,000, maybe a million, covered by this 600,000, whatever the number is. You know that within 30 seconds of that ruling, that every Democrat in the state is going to be saying, we've got to fix this problem because we've got this number of Virginians that are getting subsidies or free health care through Obamacare. What are we going to do? Kick them off the rolls? You know that the Republicans in the U.S. Senate are going to immediately try to pass some stopgap funding bill, right? So the pressure on Republicans to find some way to keep these people funded is going to be incredible, right? How do you deal with that?
Yeah, I get it, John. Let's say a couple things. Number one, Obamacare numbers are all funny to start with.
Yep.
I will tell you that probably the number of people in this category is 250 or 300,000, and I think we all want to do, something for that set of people. Remember, this is a set of people, a huge number of which were actually kicked off of plans that were working for them 2 years ago.
Yeah, like me.
Like you, okay. And so we do want to do something for that set of people. The bigger, more important thing is the 8 million Virginians that are being adversely impacted by Obamacare to start with. And so nobody disagrees with some plan on a short-term basis, but the bigger issue is the opportunity to go back and actually, if this thing goes to where the states have an opportunity, potentially the mandates, the employer and individual mandate, and all the taxes could go away in Virginia. And so Virginia might have an opportunity to do health care and health insurance reform along the lines of opening up across state lines and high deductibles and co-ops where you might be able to band together to get, the numbers you need to do real actuarial coverage. And I would think that, business community would be very supportive of approach where we might be able to do that.
Well, look, that Dr. O'Bannon makes perfect sense to me. The fear that I have is that minutes after the ruling goes down, the left is going to seize the narrative by focusing not on the 8 million that you talked about in Virginia that have been adversely affected by Obamacare, which is that those people that are working don't make enough money where it doesn't matter, but make too much money where they can qualify for something. Nobody's going to be talking about them. They've all, like me, been absolutely screwed over by this thing. All the focus is going to be what are you going to do with the 250,000 people that are not paying for insurance, that are now not going to have insurance? What are you going to do? Kick them out, kick them off the plan? That's and that's where the Republicans are going to get on defense immediately. So, knowing what the game plan is ahead of time, how do you change it?
John,
am I right?
I think you're right about the tactic that the other side will take.
Right.
That's federal government may try to come up with some scheme. We have pretty clear laws in Virginia, and we have laws on the books that say we will not establish a state-based exchange. So I think one way would be simply to grandfather these folks for 6 months or a year while we look at what our options are as far as a state. But I think there's a way we can actually handle this on a temporary basis so that individuals are not disrupted right now, but we have an opportunity to redo or renegotiate the law.
Yeah, and I think what was so inspiring about your op-ed is that everybody is talking about, or the left is talking about, the 400,000 people uninsured that are caught between Obamacare and they can't afford insurance, and that was a Medicaid expansion, and the several 100,000 people that are getting the subsidies. Wow, wasn't that wonderful? But nobody's talking about the 8 million people who got screwed by Obamacare. Nobody talks about them at all except you in your op-ed.
Well, we've been watching this play out, and we just have seen all the bad things that have gone on. There was recently, we're running our health care now through the IRS, and the IRS sent out incorrect forms to about 800,000 people in this category of the several million, 5 or 6 million that are getting this. And you know what? They say, we just sent out the wrong forms, but don't worry about it. You don't have to pay it. And so it's really turned out to be a big mess running it through this central government the way it's set up. That's why it's such a good idea to go back and decentralize it. And all those 37 states that have used the federal exchange, if the ruling goes in the right direction, will be able to go ahead and have their own ways to do this. So I'm just real strongly supportive of if we get the opportunity to try to do some real reforms here in Virginia.
Okay, I think you're on the right. House of Delegates member Dr. John O'Bannon, 73rd District Republican, Henrico. He's a neurologist, knows a thing or two about health insurance and the medical field. Doc, I just got a email here from one of our listeners, Denny in Chesapeake. He says, ask the good doctor, what's the deal now with all of these millions of people that are going to lose corporate insurance because of Obamacare coming up in 2016? What's the deal with that?
Well, I'm not sure exactly what Denny's talking about, but I think as the cost of this go higher, the companies are paying more business taxes, and so they're paring down their coverage to their employees. You know, all of us are seeing the way this current system is set up where the deductibles and the copays and the tiers for the drugs are all causing people to take more and more money out of their own pockets.
Yep.
And so going the other way, where you put the person back in control rather than the insurance company, for a lot of these day-to-day costs would be going in the right direction. Mm-hmm. Let me just real quick just say, I hope everybody will think about going down to Hargrave on April the 18th. That's our homecoming reunion day, and I hope to be there, but it'll be a beautiful day, and you're exactly right about the opportunity. Answer your question about what specifically Virginia could do. We don't need the federal government to tell the insurance companies to keep the young folks on to 26. Taking down that essential benefits package, which requires the 60-year-olds to have maternity coverage, and freeing up the carriers to carry different kinds of policies rather than the one the government says they've got to carry. And that means folks will have opportunities to have different levels. They all won't be governed by the central office, but those are the kind of policies that people had that were kicked off.
You're right. Exactly.
We could do insurance across the state lines. We could have high-risk pools for the chronically ill. Mm-hmm. The issue of the pre-existing condition has got to be dealt with, because insurance, just like any other kind of insurance, if you wait till you get the cancer to sign on, that's not really going to work on an actuarial basis. There are ways where you could actually penalize people, to get on in between your yearly sign-ups. So there's all kind of things. Look, we got 400 companies in Virginia that sell car insurance. Mm-hmm. That's a competitive market. Mm-hmm. Homeowners insurance is the same way. Your health insurance market does not work that way because of the scheme with the federal government and the insurance companies and the employers. We need to get the individual people much more knowledgeable about the day-to-day costs of things.
Absolutely.
Once you're paying for it, and you have it in your own plan, high deductible or whatever, you'll be much more focused on what that test costs when you go to the hospital.
Well, the other thing that nobody is talking about is those that got kicked off their insurance like us and then have to go find other insurance. We have found, my family has found, I'm paying double what I paid, and my deductible went from, I think, $750 to $10,000. So I basically, for my family, have catastrophic insurance. But even for things like dental and things like that, my wife has found that the level of service has dropped unbelievably, because you got to sign up or you're going to get the fee from Uncle Sam. So you're kind of screwed in this thing no matter what.
You're one of the donors that's paying for somebody else.
Damn, we're out of time. We want to thank Dr. John O'Bannon for being with us, Republican Delegate, Henrico, 73rd District. Thanks, Doc.